Hello, my name is Roger Collins. I'm one of the clinical educators here in the Department of Nursing at North Carolina Central University. Thanks for joining me today as we discuss and demonstrate interventions that are appropriate for some adult and children who are consciously choking. Now, I'm going to need some help with this, so one of my junior nursing students, Ashley, has volunteered to give me a hand here. Okay. Now, let's talk first of all how you recognize someone who's choking. Okay, Ashley, if you would, I want you to demonstrate. Now, you have some variation of this technique. Somebody may put it here, somebody may put it closer here, but whatever it is, something like this. That is our first cue that something's wrong. Color changing and all that stuff is going to be down the road, but this is our first cue. What I have to do first is verify that she's choking. I'll do so by asking her this simple question. It looks like you're choking. Nod if I'm right. Now notice there I didn't ask her to speak. Asking her to speak here would not be appropriate because she's choking. Her air may be completely blocked. I have a second question for her. I have to validate the fact that I can touch her and help her. I know CPR and first aid. I can help. Nod if that's okay. Now I've got permission to actually touch her. Now let's talk about hand placement, okay? Actually, if you'll follow along with me here, I want you to place your non-dominant hand over your belly button. This is the first area that you would need to identify, finding that person's belly button. Now, people come in all shapes and sizes and heights, whatever. So it's going to be a guessing game at first, but everybody knows what the belly button feels like. Once you've identified where that is with your non-dominant hand, you are going to make a fist. You'll bring it right above where that finger is there. You're trying to stay below that xiphoid process, which is right here. We're right here on what we refer to as the big part of the belly, the abdomen here. Now we need an in motion, but we also need it to go up slightly. So tilt it down like that. You're going to put your hand behind it as a plunger, and you're going to press. Now in this demonstration in class, we're doing so very softly, but I need to make it clear. If you're actually standing behind someone who's actually choking, you are going to, you're going to let the hammer down, okay? You got to use a little force there because you need all of the air that is in the diaphragm here and in the lungs to get behind that food bolus to pew. Now, let's demonstrate it on Ashley here, if you will look that way. I'm standing behind her. I'm finding for her belly button. I'm making this fist and I'm coming in. Again, I am doing so in a simulated fashion, not hard at all. Now, what I want to illustrate is what I'm doing with my legs here. The person who is not breathing is not going to be standing very long. You need to be ready for that if you're a rescuer. My leg is positioned here, one in front of the other one, so that if she comes back, I'm able to slide her down to the floor using my leg as a sliding board, okay? You say, is that very important? Let me show you how important it is. Actually, I want you to trade places with me. Stand where I am. Now, would you all agree that I weigh at least 5 pounds more than she does? Okay? Actually, I want you to stand the incorrect way with your legs and your feet together.
Okay.
Put your arms around me like you're intervening. Now, here's the issue. The issue for her is if she's standing the wrong way, sooner or later, I'm coming back on her. When I come back on her, we have 2 911 calls. I'm still choking and she's got a busted head, okay? So what she needs to do is prepare for that. This time, Ashley, would you stand the right way? Use your leg as a sliding board. But now when I come back, she has a measure of protection. She can easily slide me down to the floor and we can start to operate from the standpoint of a person who's lost consciousness now. All right, now let's talk about conscious choking with a child. Now, some of you may remember the definition of a child in terms of the AHA here again is 13 months, the first day of the 13th month of existence, all the way through age 12. And this is a 3-year-old child. When you're dealing with the conscious child who is choking, there's no discussion, folks. Take the knee. You're going down here. You're going to look for the belly button. You're going to take that giant adult hand of yours. You're going to make sure that you stay below where the rib cage is. And you're going to do the same thing that we discussed with the adult. You're going to give abdominal thrust. How many? You do it until the object comes out, or the child or adult goes unconscious. Abdominal thrust over and over. Now let me throw this in. Small children, because their chest area is so small, they tend to clear fairly quickly. Adults, not so much. You have to work with them depending on how large they are. Now, but that's essentially the procedure there for the child. It's essentially the same as the adult. You just have to sort of drop it low. And the first thing you're going to do now is compressions. Now, some of you are thinking, wait a minute, compressions, aren't those for people with stopped hearts? Let me explain the science to you. Watch my hands. We're going to do CPR, but this time, the scientific principle is every time I compress into the chest wall, I am pushing the food stuff in the esophagus up to the back of the mouth. So when I get to 30 compressions, just like with CPR, I'm going to look in the mouth. I won't immediately try to ventilate the patient. I'm going to look in here and see if I see any food debris, okay? If so, I'm going to take it out. We don't do a blind finger sweep on somebody who has nothing there, only if they've got something in their mouth. Now let me demonstrate what we're going to do by giving 30 compressions, then we're going to look into the victim's mouth. All right, here we are with the 30 compressions. Just like with CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 30. I now turn my attention to tilting the head back. I'm going to look into the mouth, and if I see food debris, okay, I'll look down and say, okay, I need to get that out. You're going to take your finger, go inside of the victim's mouth and rake it all out, throw it down on the deck, the floor, the dog will get it later, okay? And now we need to ventilate this patient. If you're comfortable doing mouth to mouth, as we discussed earlier, you can put your mouth over the lips here. If you've got a device, like I got in my hand here, a barrier device, certainly feel free to use it. Now, one attempt at ventilation. Now, suppose the chest does not come up. What happens then? Either I don't have the head tilted right, or there's still something down there clogging his windpipe. So what I need to do now is, just to rule out operator error, I'm going to readjust it, and this time making sure that I have the head tilted back. I will try another breath. Now, if the breath goes in, we were successful. If it doesn't go in, I need to go back and do 30 more compressions, look back in the mouth, remove any debris with my fingers, throw it down, and attempt to ventilate again. Now, let's assume for a moment that we've cleared the obstruction. What next? Well, there are 3 possible outcomes here. Number 1, Uncle Charlie wakes up and says, oh, I was about to see the bright light. Oh, thank you. Well, all is well with the world. Or you cleared the obstruction, but it took you so long, they no longer now are responsive. You don't see them breathing, and there's no pulse. That means make Johnny well sure that somebody calls 911, and you have to continue CPR. Now, there's one additional outcome here. They still have a pulse. Pulse is not dropped, so you don't need to get on their chest, but you may not have them breathing. So you notice their chest is not going up and down. You need to breathe for them. I don't know if you've ever paid attention to this, but while you are breathing, you take a breath every 5 to 6 seconds. Every 5 to 6 seconds, you breathe. That's what we have to do. When it's time for you to take a breath, it's time to give Uncle Charlie one, okay? What you're going to do here, let this stay in place, or if you're doing mouth to mouth, you're in place over them, you'll squeeze or breathe for them. 1, 2, 3, 4, 5. Again, you're going to repeat this pattern, and you count. It's helpful to count out loud or up under your breath. I'm at 5 now, so here's another breath. You're going to repeat that till Uncle Charlie starts to breathe or the EMS vehicle roll up, okay? All right. Now, I hope that clarifies unconscious choking for the adult. Let's turn our attention now to unconscious choking for the child. I've got good news. When it comes to unconscious choking for a child, everything is exactly the same. The only caveat that I'm going to offer here is to make sure that your hands are in the right position, making sure that you're above where those ribs come together. But it's the exact same position here for unconscious choking for a child.